When I came back from surgery, I would talk to parents and I would talk to students, and I had students say to my face, I don't even know who you are. I'm like, I'm Miss McGuire. And they're like, oh, you are? Like, it just was surreal. I had a tumor, a growth on one of the condyles on one side of my face. So one side of my face had been growing longer than the other for at least 20 years. Because one side was longer, it caused the other side to kind of jam in and kind of crunch in together. So I had a lot of pain on the opposite side of my face. And finally, my husband is the one who's like, honey, looking at you, something is not right. And so I finally went to a doctor, and the orthodontist was the one who's just like, you are absolutely right. Something is not right with your face. And that's kind of when just like the dam broke, and I just started crying because somebody was like validating it. Because I'd go to my dentist and I'd say, my teeth, like I only chew on one side and something's wrong. But the dentist isn't trained in all of this. So my dentist just kept saying, no, you're fine, or joint pain is normal, or go to physical therapy. They just kind of kept dismissing it. And so by the time I finally had an orthodontist just look at me and look at my x-rays and say, yes, there is something wrong, it was honestly very relieving for me. When it came to once I was fully healed, what my first reaction was a little bit of excitement to have a symmetrical face, but it was also quite terrifying because I did not recognize myself. It took me a while. It took me almost a year. One of my friends is a psychologist. She gave me a book. It's called Mirror Work, and it was about just looking in the mirror and just talking to yourself. So the pieces in that book that were applicable to me helped. So I started talking to myself in the mirror. One of the things that I did was I took pictures of my new face and I put them up around the house so that I would get used to seeing my new face. And I think that those two things helped tremendously. I think, honestly, my husband, he would just listen to me and he would just remind me, he's like, but I see your eyes. He's like, you're still my Jane. You still have your same voice and you still have your same humor. And I think him just reminding me that I am the same person is really hard. My advice would be to talk a lot with your surgeon, talk a lot with your doctor, develop that rapport. Because there were times where I just called Dr. Movahed and he answered the phone. I tried to respect his time and his boundaries, but he made it very clear if I needed to, I could call the office or I could even just call him. The other advice I would give is be very informed with your recovery. Know exactly what you're getting into. Know exactly what to expect. I would have reached out to a counselor sooner about body dysmorphia. Even if it doesn't happen to you, just going in knowing this could happen, and if it does, what conversations do we need to have? What books can we read? Who can we talk to about it? Just having that prepared piece, again, for less fear and less uncertainty. I'm just so excited to be symmetrical and have my face be symmetrical. I think one of the things I really admire and one of the things I really respect with Dr. Movahed is that not only he wanted me to physically be fine, but he also knew that this was a face I had to live with for the rest of my life. I just really loved that he not only wanted to fix me physically, but he wanted me to be happy in the end. Not only healthy, but also happy with the results.